Hey guys, welcome back to Medical Coding with Blue. It's Q&A Tuesday. Sorry about the late edition. Today was just one of those days. But first, I want to say thank you guys for all of your feedback, all of your questions. These questions are really helping to shape this episode today, so I really appreciate it. So thank you again. And without further ado, let's get started. Is there a difference between vocational school and technical school? I believe that word is synonymous. So, no. But if you are interested in sitting for an American Health Information Management Association credential, you want to make sure that that school is AHIMA accredited. So the best way to do that is to take the name of the school and put it into the search engine on the website itself, and it'll let you know if they are AHIMA accredited. So be sure to look into that, and I will leave the address for AHIMA and for the American Academy of Professional Coders down in the description box below. Okay? Number 2, working in the medical field. How do I go about getting certified? Well, you could sit for your certification exam. Just whenever you feel like you're ready, look on the website, check out AHIMA and AAPC to see which association you want to get involved with. I recommend in the beginning to at least get involved with just one association. I know that there's people that have both associations or members of both associations and they end up getting 2 and 3 credentials. That's great. But if you're just starting out, just start with one because you don't want to overwhelm yourself, okay? Pick one association and go through that association and look at the credentials that they're offering and see what it is that you need to have to get to that credential that you want, whether it's an entry-level credential or whether it's a higher one. Just be sure to see if you meet the criteria for whatever credential you're after, okay? Number 3, this is a point I wanted to bring up, is check out the self-paced programs that AHIMA and AAPC both offer. If you are looking to get into medical coding and perhaps you don't want to go to a vocational trade or technical school, however you say it, you can go to the website, and both associations have self-paced courses that you can go through for medical coding. So be sure to check those out. I mean, they're directly from the associations themselves. So what better way to learn about the field than directly from the association itself? So be sure to check those out. Okay. And sometimes those are better fit for some people. Some people don't want to take the time to have to stop their workday and go to school. So that's fine. I mean, if you go to a self-paced program through one of the associations, you're basically doing it online and it is at your pace. So you can go through it as quickly as you want to or as slowly as you want to. And remember, we have all of our chats here. And this is just me as a civilian coder that is just talking to you guys. I mean, this isn't sanctioned. This isn't official. Okay, this is just an experienced coder who is sharing her experience with you guys. And so a lot of what I talk about, whether it's on Q&A Tuesday or Quiz Friday or Answer Monday, these are things that happen in real life, because if you're in school right now, you're going to learn that school coding is way different from being on the outside and coding. I learned that, it wasn't the same as when I was in school, because you're learning from a book. And then when you're with like people and providers and seeing real life documentation, you're like, whoa, So this is why I try to talk about these things here, so that way you can kind of get an idea of like, oh yeah, this is really different. This is something that I should try to start learning. And if you're a veteran medical coder, sometimes it takes another person kind of like getting you to look at it another way that really does help. Because even though I've been in the field for over a decade, I'm still learning. And sometimes when I come across somebody that's really smart and really knows what they're doing, and I start seeing how they code and things that they're starting to pick up, and I'm like, "Ooh, I never thought of that," or "Oh, I didn't know that." I still do that to this day. But I always make sure that if I am looking at somebody and I'm listening to their direction, that they are coming to me with their resources. You never want to take somebody's word for anything. This is why I always try to, whenever I give you guys anything like pointers or anything, I'm telling you guys where I'm finding my reference at. Where's my resource? How did I come up with this? How do I know this? And that's always important to remember. Okay, you always want to make sure that everything that you talk about or that you do is backed up with a reference. Okay, always remember that. That's something to keep in mind. Okay, pointers on sequencing was number 4. So I need to do a whole episode on this, because this is something that in the beginning it was like, how do you know which one to put first? But very quickly, when it comes to sequencing, if you have a patient who has, say, 3 different diagnoses, you're going to look at the diagnosis that is a reason that they came in. Why did they come in? What is the most pressing issue for them? Because sometimes, like, say, for example, if they have osteoarthritis, but at the same time they have diabetes, that's going to affect them if they get a shot, that is something that, okay, you're not going to code the diabetes first, even though that's a major condition, but that's not the reason that they would go to, say, for example, orthopedics. If they're going to orthopedics, they're going to be seen for that osteoarthritis, but that diabetes is going to be secondary, because it's not the reason. That's not a endocrine clinic, you know what I'm saying, or PCM clinic. That is the orthopedic clinic, and that is why they came in, because of the osteoarthritis. That diabetes is secondary because it does affect them, so you still want to be able to pick that up. But the reason for the visit is usually going to be the first heaviest one is going to be that first listed code, unless it is like, say, for example, it's a pre-op appointment, that Z01818. Yeah, I just did that off the top of my head. That code is a first listed code, because that is the reason for the visit, is a pre-op. Okay, so if the patient's coming in and they're doing a pre-op appointment, that Z code is going to be first. Okay, one other thing about sequencing, external cause codes, they're never first listed. Okay, so it's always going to be like an injury. If you have an injury and that's the reason that the patient came in, the injury code is going to go first. So we'll talk about that. That is a good idea for an episode, because that does need to be expanded on, so that way I can be a little bit more clear on that, rather than just a couple of seconds of talking about it. But yes, that does get to be a little bit of a challenge, like which one goes first, which one goes second or third. Yeah, but yeah. Okay, so next one. Okay, number 5. Would you recommend a new coder to work as a biller or coder, or just stick with coding as their first job? So, whatever you can get into to get your first job, you want to go with, okay? You don't necessarily have to start out in billing. If you have your credential and you can get a job as a medical coder offhand, go ahead and become a coder. Some people get started in medical billing because they don't have experience, so they need to gain experience somewhere. The reason that getting jobs as billers, or as in medical records, or in billers insurance, or like medical records, you want to get involved in that department, because that's how you're going to start meeting people. I know that if you're in school, you may have heard that you have to learn how to sell yourself when you start looking for jobs, or when you're out there applying, because it's important that you make those good connections, because as many of you will know or find out soon enough, a lot of people want to have a year or 2 years experience before they even start hiring you. So a lot of people get frustrated when they start out in medical coding because they can't get hired anywhere because no one will give them a chance. I've done several videos on this already, but it was hard for me, but I had to keep pushing. And when you push and push and push, you eventually get what you want. And in my case, it was a matter of me physically moving from my hometown into another town so that way I could keep working. That's just something that I had to do. So I will try to link that video down in the description box below so you can check that out if you haven't already seen it. That was just one thing that I had to do. But if you are working in billing, or if you're working in medical records, this is a good area to work in, because anything in patient administration, because this is going to get you around those people that have the influence of, these are the people that I am going to be interviewing with. So let me make a good impression on them. And at least that way they know, hey, when there's a job opening that opens up, hey, so-and-so has been working in medical records and she got her certification. Let's give her a try. So this will get you that kind of experience in the door. Obviously, you always want to try to get for medical coding, but if you can't, you got to try to get something as related as you can, which is the billing or patient administration somehow. Okay, so that's just my advice on that. All right. And finally tonight, advice for test takers. So I have gotten many emails this week about people taking their certification exams pretty soon. I am excited for you guys, and I hope you guys let me know how you do. But I just want to give this advice to you guys. You've studied, okay? If you have studied and studied, you're ready. You're probably more ready than you know. So try. I know it's easier said than done, but try not to be nervous. Okay? Go in there and show what you can do, and show that you know that you've been studying, and you can do this. Fear of failing, or fear of is and I'll tell you what one of my instructors told me at school is, it's fear of failure when it comes to taking these tests is it's just a very, how did they say it? I'm trying to remember. But it's a counterproductive emotion. You don't want to go in with a negative attitude. You want to go in with a positive attitude. You can do this. You've studied hard. You've worked hard. And now you're going to go prove it, because you're going to go pass that test and you're going to get that certification. And then you're going to go out there and you're going to be a medical coder. And you're going to continue to watch my videos, right? So just relax and really kind of have fun, because what challenge are they going to throw at you? And if you've done all your studying, it'll work itself out. You'll be able to get there. Okay? So just be sure to rest. Get plenty of rest. Don't try to cram. Whatever you do, do not cram before you go take your test, because all you're going to do is make yourself nervous. Okay? Don't do that. Okay? My advice to you is just relax as much as you can. Don't overthink things. And go with your first choice, whatever you do, because sometimes people will choose something and then they overthink it, and then they say, oh no, I'm going to change it, and they change it to another thing, and guess what? You get it wrong. So always go with your first gut reaction, unless you know for sure that you did it wrong, then yes, of course, but if you just go with your first reaction, just and oftentimes that's the right answer. So don't overthink things. Whatever you do, don't overthink things, okay? And you've taken tests before, and you've passed tests before, right? So think about that too. And there's a meme that's out there. Not that it's a bad day or anything, but it says you've survived 100% of your bad days. Same thing. You've survived 100% of your other tests, right? So just think about that. And I hope you guys let me know how you do, because, I'll give you a shout out if you want to. Just let me know. So, but my best to all of you that are taking your exams soon. I hope you'll let me know how it goes. I'll be rooting for you, and I'm excited for you all, and I'm excited for any new medical coder. So just keep that in mind. You can do this. Just remember that you can do this. All right. So I will go ahead and close this video out. And I will see y'all tomorrow for tomorrow's episode. I'm still kind of going back and forth on what I want to talk about, because I have 2 episodes ready. I will let y'all know tomorrow. So thank you for watching. And if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, be sure to like and subscribe and follow me on my adventure in medical coding. And I will see y'all on tomorrow's episode. All right, bye.